The year is 1685, the King of England is dying, and his doctors are making him worse on purpose. Charles II has collapsed at Whitehall with what his physicians describe as an excess of corrupt humors pressing inward towards the brain. So they open a vein in his arm and drain 16 ounces of blood before he has finished falling. Then they blister the back of his skull with a burning compound to draw the corruption outward through the skin. Then they purge his bowels. Then they bleed him again. He survives 4 more days of this. Then he dies. And not one of his 12 attending physicians believes they made a wrong decision. That is not the interesting part. The interesting part is why. Your instinct, when you hear this, is to reach for the word barbaric. To place these men on the far side of a line you are standing safely behind. But that instinct is exactly what gets in the way of understanding them. Because what those 12 physicians were doing in 1685 was not torture dressed up as medicine. It was medicine built on a body model so internally consistent, so geometrically complete, that deliberate harm was not a failure of the system. It was the system working. Here's the older paradox. Every medicine before roughly 1850 was built on an idea your body already half believes. That sickness is something in excess, something trapped, something that needs to get out. You feel it when you have a fever and crave cool water. You feel it when your stomach turns and some older instinct says, let it go. Let the thing leave your body and you will be better. The ancient physicians did not invent that instinct. They formalized it. They gave it a geometry. The framework that ran Western medicine for nearly 2,000 years traced back to Hippocrates in 5th century Greece, and was built into an architecture by Galen of Pergamon around 160 AD. 4 fluids: blood, phlegm, yellow bile, black bile. Each one tethered to a season, an organ, a temperature, a quality. Health was not the presence of something good. It was a balance. The 4 humors held in proportion to each other, and disease was imbalance. One humor in excess, one humor corrupt, one humor trapped in a region of the body where it did not belong, which meant the physician's entire job was displacement. Get the excess out. Restore the ratio. The body would do the rest. So when a physician cut you open and watched a dark cup full of blood run into a bowl, he was not hurting you for the sake of hurting you. He was draining a surplus. He was doing the same thing a gardener does when the soil is waterlogged. Remove the excess, and the thing you are trying to keep alive has room to breathe again. But blood was only the beginning. The Hippocratic text described emetics, preparations that forced vomiting, as standard treatment for fevers where the corruption had settled in the upper body. Dioscorides in the 1st century catalogued hundreds of purging plants, hellebore among them, a dose strong enough to empty a man's bowels 6 times before noon. Nicholas Culpeper, writing in London in 1652, still recommended it. The logic had not shifted in 1600 years. The gut held excess. The purge expelled it. The expulsion was the cure. Blistering worked on the same architecture but aimed at the skin instead of the gut. A physician would apply a compound, often Spanish fly, cantharides dried and ground into a paste, to a patch of skin on the back or the chest or behind the ear. Within hours, the skin rose into a fluid-filled blister. The physician then drained it, and there, in the bowl, was proof. Visible fluid drawn from a body that had been holding it in the wrong place. The patient would watch this happen to their own skin and feel, correctly by the logic of the system, that something had left them, that the body had released what it was keeping. That visible discharge mattered more than you might think. It was not incidental. It was the evidence. Pain and heat and fluid loss were not side effects the physician regretted. They were signs. They confirmed the treatment was reaching the corrupt site, drawing the trapped matter toward the surface, moving it in the right direction. A treatment that produced no discharge, no sweat, no visible outflow was a treatment that had not worked. A treatment that made you vomit or bleed or weep fluid from a raised blister was a treatment doing exactly what the textbook said it should. Qadri took this further. The Arabic physician Ibn Sina, writing in the Canon of Medicine in 1025, described burning specific points on the body with heated iron as a method of last resort for conditions where the corruption had gone too deep for milder expulsion. The heat, he argued, sealed pathways that were leaking the wrong matter or opened ones that had closed around a blockage. Pain was the proof of contact. Contact was the proof of action. And so the question sitting underneath all of this is not whether these physicians were cruel. The question is whether cruelty is even the right word for a man who believed, with the same certainty you believe in gravity, that he was pulling the poison out. So here is the turn. Not everything those physicians did was wrong in the way you think it was wrong. Some of it was wrong for the right reasons. Some of it worked despite the explanation attached to it, and some of it has survived stripped of its humoral dressing into the medicine you trust today. Start with honey. Egyptian physicians were packing wounds with it before Hippocrates was born. The Ebers Papyrus, written around 1550 BC, lists honey as a wound, dressing in dozens of preparations. The humoral explanation they would later attach to it was nonsense. The mechanism underneath it was not. Honey is hygroscopic. It pulls water out of a wound bed and out of the bacterial cells trying to colonize it. It is mildly acidic. It releases hydrogen peroxide in low, steady doses as it reacts with tissue fluid. The ancient physician watching a honey-dressed wound stay clean while an untreated wound beside it turned black did not understand why, but he was seeing something real. The wound dressed in honey sometimes did better. The practice outlived every theory ever built to explain it. Medical-grade honey dressings are still used in wound care today. Willow bark is the same story told more slowly. Dioscorides recommended it for pain and inflammation in the 1st century. Galen used it. The bitter compound in the bark, salicin, converts in the body to salicylic acid. The aspirin in your medicine cabinet is a synthesized, stabilized version of the same molecule. No one in the ancient world knew what salicin was. They knew the bark reduced fever and eased pain and had been doing so for long enough that no one could remember the medicine without it. The theory around it shifted with every generation. The molecule did not. Maggot debridement is harder to say plainly without your instinct flinching, but say it plainly anyway. Military surgeons in the Napoleonic Wars and again in the American Civil War observed that soldiers whose wounds had been colonized by certain fly larvae before treatment arrived sometimes had cleaner tissue than soldiers whose wounds had been dressed immediately. The larvae of the green bottle fly eat only necrotic tissue. They leave the living tissue alone. They also secrete compounds that inhibit bacterial growth. The mechanism was invisible to every physician who ever noted the pattern. The pattern itself was real enough that maggot therapy is still used in some hospital wound care units for exactly this purpose. But here is where honesty requires a harder cut. For every honey, every willow bark, every accidental discovery wearing a wrong explanation like a coat, there were a dozen treatments that worked on nothing but the theory. Bloodletting for fever did not help the feverish patient. The evidence for this is not recent speculation. The French physician Pierre Louis published a statistical analysis in 1835 comparing blood patients to unbled patients with pneumonia and found the blood patients died at higher rates and faster. He was largely ignored for another generation. Purging with hellebore did not restore humoral balance. It stripped the gut, dehydrated an already weakened body, and added a new insult on top of the original one. Cantharides blistering produced a real wound and a real risk of systemic toxicity from a compound that is genuinely dangerous in any quantity beyond trace amounts. The visible discharge those physicians read as evidence of cure was often evidence of a body being pushed toward a new crisis. So the honest line runs here. Some ancient treatments had partial mechanisms, even when the theory was wrong. Some had no mechanism at all and worked on nothing but the conviction of the person administering them and the body's own recovery running in the background. The physician got the credit either way. That is not a small thing to understand about medicine before controlled trials. The body heals a great deal on its own. Anything happening at the same time the healing occurs looks like the cause. And this is why visible worsening was so persuasive. A blister rising on the skin, a purge emptying the bowels with force, a bleeding wound running dark before it slowed. These were things the patient could see and the physician could point to. The logic of expulsion gave every dramatic side effect a narrative role. The fever, spiking higher the night after treatment, was not the treatment failing. It was the corruption moving, being driven from its hiding place before it left the body. The patient who survived looked like proof. The patient who didn't had been, the records often say, too far gone before the physician arrived. Celsus, writing in the 1st century AD in De Medicina, described the good physician as someone who could read the body's signals and know when to press harder and when to wait. That instinct, the reading of the body's direction rather than just its current state, was real clinical skill. It was embedded in a framework that was wrong about almost everything beneath it. But the skill was real. Here is what this history is actually about. It is not about stupidity. The physicians who bled Charles II in 1685 were not less intelligent than the physicians who would correctly identify germ theory 2 centuries later. They were working inside the best model available to them, the way anyone works inside the best model available to them. What they lacked was not intelligence. It was the tools to falsify the model. Without controlled comparison, without a way to isolate one variable and hold everything else still, the humoral system kept explaining its own failures, and no one could see the explanation was circular. And underneath all of it was a thing that has not changed between that room at Whitehall and any room where someone is frightened and sick today. The need to do something. The conviction that watching and waiting is a kind of abandonment. That action is care. That a physician who produces no visible effect has produced no care at all. The body on the table then was the same body. The fear was the same fear. The difference was only the model, and the model, in the end, is always provisional.